I feel like I am relearning pain science.
I make it very simple. Your pain, your thoughts, and your emotion are all connected in the brain. Pain is more complex, and we have to kind of look at all of those elements that's perpetuating that pain cycle to get people to bring that down.
Welcome back to the Move Room. My name is Catherine Reber, and I'm a doctor of physical therapy working out of Kinetic in Westchester, Pennsylvania. And today I'm joined by Dr. Asare Christian, who we as a company have worked with for quite a few years now and learned a great deal from. But Dr. Asare Christian has his own pain management and wellness clinic located on the main line in Wayne, Pennsylvania, called Aether Medicine. And he does so many things, but primarily specializes in cellular medicine, hormone optimization, integrative pain management, longevity and anti-aging medicine, peptide therapies, regenerative medicine. I mean, the list goes on and on. So obviously you're just an amazing dude that, you're highly sought after. But thank you so much for joining us today.
Thank you so much for having me, and I'm so excited to be here.
I know.
Like you said, we go way back when I met you guys like 5 years ago.
Absolutely.
And I've worked with you guys and such a big fan of Kinetic and what you do and what you stand for. So it's great to be back to be talking about where I am now since the last time we connected. Yes.
So take us back, because I don't even know if I know your whole origin story. Like, what were you like growing up? Like, how did you even get into conventional medicine to start off with?
Yeah.
And then tell me about the transition into what you do now.
Yeah, so my background, I grew up in Ghana. So I'm from Ghana. I grew up there and then came to the U.S. when I was done with high school. And then went to college in Milwaukee, Wisconsin, went to medical school there, did residency in physical medicine and rehab. And so that's where my background in pain management, rehabilitation came from.
Got it.
And then from there, I did a fellowship in Boston and then ended up in Pennsylvania. So when I got here, I was doing regular rehab medicine, neuro rehab mostly. So spinal cord injury patients, TBI, stroke. And then from there, I got into pain because all these patients had pain and nobody was really treating them well. So I kind of picked that, and that was the journey of getting into pain medicine.
Right.
Yeah.
How did you get to Pennsylvania? Like, what brought you here specifically?
Yeah, so when I was finishing my fellowship in Boston, one of my attendants from Hopkins, I went to Hopkins for residency. So he was the chief medical officer of a hospital here, a rehab hospital, rehab hospital.
Okay.
And I needed a letter of recommendation. So I was like, hey, Dr. Singh, can you write me a letter of recommendation? And he said, yeah, I can write that for you. But by the way, I'm hiring. So do you want to come and interview? And I was like, where are you? And he's like, I'm in Allentown. I was like, well, where is that? So I couldn't say no because it's the guy who's going to write me the letter. So I decided, okay, I'll come check it out. And I came and they made me a good offer. At that time, I wanted to have one day off to do some research. So this is the only place that was willing to give me that time to do some research. So I ended up coming down this way.
Sure.
Yeah.
How long were you working there for?
I was there for 8 years.
Okay.
So 8 years, did a lot of stuff, did a lot of programs because I'm always learning. I'm interested in learning. So during that time that I was there, I started a spasticity clinic. I also did a concussion clinic. We run, a whole program. So everything was programmatic. So we have the physical therapy because it was a great place for all the teams, the PTs, the OT, the neuro, everything was there. So it was easy to build a program as a physician because all the team that makes everything translate were there. So we did a concussion clinic. I even did a bowel and bladder clinic. So I was even doing urodynamics. So I like to learn. I did an ultrasound clinic. So it's all about programs because when you put things together where there's the infrastructure in place and the right teams in place, then people have better outcomes. So it was a great place to, grow and still on that journey. Yeah.
So when you were there in Allentown, was it primarily, I mean, it's just the global term, but the conventional medicine approach? How is that different from what you're doing now?
Yeah, so very, very different from what I'm doing now. And that's also evolving because when I was there, I did a lot of things. I saw all these patients coming in, a lot of our patients with disabilities and injuries that is hard to kind of get people to actually recover. So mostly conventional medicine. I was sending people to PT. I was sending people to acupuncture. I was sending people to all of these other things. I actually was more integrative back then, medications, injections. And then what I kind of started seeing, especially chronic pain patients, like there's patient population who do get better. And when it comes to chronic pain patients, what I saw was that, they were doing all the right things. They were going to PT, they were getting injections, I'm giving them the medications, we're doing everything you're supposed to do, yet they were still not getting better. They still had pain, they still had fatigue. So then, I got to a point where I recognized that a lot of the people who came in, the people who had better outcomes, whether they were going to physical therapy, whether you're giving them the medication, whatever it is, whatever intervention it was that I was giving to these individuals, when those people are healthy, they have better outcomes. Okay. And pain, and we're going to talk a little bit about pain, but pain management from the conventional lens is only signal blockade. We are blocking that pain signal. We give you ibuprofen, we give you steroids, we give you injections. It's just blocking that pain signal. We are not addressing the underlying issues that's driving that inflammation or whatever it is. So the inception was, how do I figure out how to make people healthy as a way to solve pain? Because when people are healthy, then everything you do for them actually got better. So fundamentally, it was important for me to learn how to make people healthy.
Absolutely.
And that's what transitioned me to this new practice.
And I think even from a PT perspective, I mean, of course, we see so many patients that even in our mindsets, the first thing we're looking at is how do we solve this symptom?
Yes.
And I think it's so much greater than that. Because like you said, like there's some people that get better.
Exactly.
They get better very fast. And you kind of just have to sit back and wonder, like, why is it that person when you have another person that may be coming in, same issue going on, and it's taking them months and months and months to get better. Or, we maybe get to the point where like they're better, yes, but we don't want them to be in PT forever. Maybe their insurance is up and, we kind of send them off with a home program, but they're not healed. So I think there's that big delineation between, working on the symptom versus healing the body and like why the body failed to heal that symptom in the first place.
Exactly. And a lot of times patients feel like they fail treatment.
Right.
It's rather the treatment that has failed them because sometimes we have to go a little bit deeper to try to solve the underlying problems that's driving the symptoms.
Sure.
Okay? It's easy to see symptoms and it's, sometimes it's very frustrating because you're doing everything for the person right in front of you.
Right.
And nothing else is working.
Right.
And it's not the person. It's just that there is something else within their biology and their psychology that's influencing the ability to heal. Is it more inflammation? Is it their habits? So a lot of times people have all these habits that perpetuate pain.
Right.
And I'll talk to people about, there's always something that starts your pain. So people will remember the inciting event. I fell, I was in a car accident, something happened and I had this back pain. And they've had this pain for 10 years. And they've had surgery, they've done injections, they've done everything else, and they're still in pain. So what's keeping pain in place is not the accident. Now it's a new issue. It's a function of their health. Do they have any microbiome dysfunction? If they have gut issues, that's how your immune systems are programmed to either heal or to make a good choice. Are they sleeping? If you have a lot of stress and you're making cortisol, that's going to keep you in a pro-inflammatory state. You're going to have more inflammation. If you have unforgiveness, if you have past trauma, all of that influence how your nervous system. So there's all these pieces. What you're eating will influence your pain. Sleep. So all these things, hormones, they all play a part in how your body heals. So when those things are not optimized, then people don't get to where they need to be in terms of responding to all those therapies that we do for them.
And I think in some aspects that can be so great for someone to hear, like, okay, I've been having this pain for years now, and it's good to know that I'm not going crazy. Like it's because of how my body's responding. But in other ways, it probably can sound overwhelming. And I think that's what today is going to be great to be able to like break that down a little bit, simplify some of these things, because I know of course, like what's happening underneath your skin is very complicated.
Absolutely.
But it's nice to know, like you said, that this whole field in terms of looking at it this way is evolving so fast.
Absolutely.
So how long ago did you start Aether Medicine?
So yes, I've had Aether Medicine for 5 years now.
Okay.
And the interesting thing is when I even started this practice, the inception was I need to figure out how to make people healthy, right? How do you make people healthy? And I did not know how to make people healthy. I knew how to read MRIs. I know how to do ultrasound injections. I know how to prescribe medications. I know how to do injections. But I didn't know how to make people healthy, right? And so I have to actually go back and do another fellowship to really learn how to do those things. Because when we're in medical school, we learn, and it may be the same when you're in graduate school, you learn all this physiology of how things are supposed to work, right? And then once you get through residency and you become a physician, attending physician, depending on which environment you're in, you're solving pathology, you're solving sickness. So when people come to the hospital, that's not when we're talking about nutrition. That's not when we're talking about stress. We're trying to fix you so we can get you home. So that environment actually takes away the ability to learn how to solve health. How did this disease develop? How do we prevent the body from progression? Or better yet, how do we reverse those processes that are going on? And it boils down to the cell. Okay. So for me, when I got into this space trying to figure out how to make people healthy, I have to really understand the fundamentals. And we all know those things. And that's kind of the things that I want people to take away. Nutrition is super important in your pain and overall health. Sleep, very, very important. When you sleep, that's when your body is healing. You're making all these antioxidants. You're making all of these genes and proteins that your body needs to kind of power you through the day. And in fact, we spend a third of our life in sleep. So sleep is so important. And it's about the quality of the sleep. Okay. It's good for the brain. It's good for overall energy. And people can validate for themselves. If they don't sleep,
absolutely,
you get crabby, right?
I had a baby last year, and just this, it has been one of the things that has opened my eyes to what a lack of sleep does. I mean, you could be doing everything right, exercising, eating well, staying hydrated. Yep. If you don't get a good night of sleep, I mean, it's like somebody hit me in the head with a baseball bat.
Yeah.
It's unbelievable. And I honestly feel inflamed. I feel like a little achy in my joints. I feel tight and tense, even though my body probably isn't tight or tense. It's just how it's responding to that lack of sleep.
Exactly. So and sleep is one of those things, in the space of longevity medicine. Now I have to go do a fellowship, and actually in longevity medicine, that's how I've kind of learned how to kind of keep people healthy. And one of the things that ages people more than anything else is lack of sleep. Okay. So sleep is important. Movement, exercise. There's no better drug. There's no pharmaceutical drug that provide all the benefit you get from exercise and structured exercise and knowing what to do. Stress response. There's good stress, there's bad stress. How do we get you to modulate that? Because even when you're exercising, when you're pushing yourself, you're stressing your body. But all of those things have to be quantified in a way that you become very specific. Everybody knows you're supposed to exercise. What type of exercise is good for you, Catherine, versus me, versus somebody else? Based on your goals. Are you trying to lose weight? Are you trying to train for a marathon? Are you trying to just stay healthy? So there's all of these nuances. And then on top of it, you are a person who is very unique biology and very unique physiology that we need to kind of make things personalized. So it became kind of going back to learning how to do those things very well and very precise. So there's all these tools that we have now to really be able to quantify people's type of exercise that they do need. So we do this thing called the metabolic testing. So that gives me a framework of how efficiently are people making energy? Because all this talk that we're talking about, I think what I want people to take away is health is a function of your cells and it's a function of energy, okay? Your cells have all this intelligence, all the cells. Your body is made up of all cells. You take your bone, it's made up of cells. Your skin is made up of cells. Your heart, all of it is made up of cells. And all of these cells have the intelligence to adapt in a healthy way or unhealthy way based on a signal that it receives. What is that signal? Sleep, nutrition, exercise, stress response, community. And then we can bring in small molecules or medications. It's a signal, right? Supplements are signals. Peptides are signals. Hormones are signals. So how do you put all of that together? So when the cells have that, everything works well. So that is kind of an approach that I took going back to understanding the cell. And it's all about energy. If the cells can make energy efficiently, then you can make good decisions, okay? So when people are not healing, we have to look at what's going on with your mitochondria. This is the cell that makes energy. When people have fatigue, it's a function of energy deficiency at the cellular level. When people have, immune dysregulation, they got COVID, they're not getting better. The immune system is affected. Why is the immune system not making a good decision? It doesn't have enough energy or it's not making energy efficiently. So there's all of these things that boils down to how the cell is functioning to be able to translate to, how do we get people to heal or to see health?
How, not necessarily you, but just scientists in general, how over time did they realize that? Like how were they literally looking at little slides, seeing like what is going on with the cell? Did it look dehydrated? How did that occur?
Yeah, I think cellular biology has been around. So, this science is like old science. We've known how the cells function. The basic unit of the body is the cell, and it has a membrane, and it has the nucleus, and it has a mitochondria. So, there's other things in there. But the cell has this unit to be able to make all these decisions. And its goal is to replicate, reproduce, make energy efficiently, communicate, and survive. Okay, so this is things that we've known. And specifically when it comes to this intelligence that I'm talking about, it's actually the mitochondria, the cells that makes energy, or the part of the cell that makes energy, and your nucleus, the center of the cell that has all this information on what kind of proteins are we going to make, how are we going to get you to heal. All of those things are being done between the nucleus of the cell and the mitochondria. And the mitochondria, they've actually looked at this with all this advanced microscope, where when you're making energy, there's actually, it looks like a car. It's an engine that's spinning. It's actually spinning. It's a motor. So you have this ATP engine that's spinning try to make energy. And when he makes energy, he also creates something we call oxidative stress or reactive oxygen species. Okay. So the simplest way that I try to explain to people how this works in terms of making energy is, you have a car, you put in the gasoline, and then the car starts working, the engine is working, but the engine is helping the car to move, but you're also creating fumes. And then the engine is also warming up, okay? So the engine warming up and the fumes that's coming out is what we call oxidative stress. So when the engine can perform very well without creating a lot of heat and without creating a lot of fumes, the engine lasts longer. The same thing happens in our physiology. So if we can get people to understand, like, how do we get your cells to make energy efficiently? And what kind of gasoline are we putting in? Are we putting in glucose? Are we putting in fatty acid? Or are we putting in amino acid? Those are the sources of energy, okay? And we actually prefer your cells to use fatty acid because fatty acid makes it more energy. It doesn't heat up the engine, and it also doesn't create a lot of fumes. Glucose, so the things that people are doing, the sodas, the sugars, all of those things, when you actually put that into the engine, those actually creates a lot more waste, and it also doesn't give you a lot of energy. So this, I think the question was like, how do we know all of these things? But it's been evolution in this membrane cells. There's all of these other things that we know that, we've known for a long time. And it's just being able to translate that biology into how we take care of people. To think about those things instead of just like, okay, take a medication for this problem. But let's go to the cellular level. What's there that's not working? Maybe your hormones are dysregulated. And I see this in my clinic all the time. People come in, women going through menopause, they start having joint pain, all of this stuff. And that's actually how I got into all of these things. It's always somebody coming to me with a problem, me trying to figure out what is going on here besides why can't I fix this? And then I go, oh, okay, they have a problem with their hormones. Then I have to go learn about hormones and how do I solve that in a healthy way to help my patients.
Sure.
Yeah.
I know when I first started working here 5 years ago, when I had first heard your name, you were kind of the person, like the tool for us to be, okay, if you have somebody who, again, you're doing all the right things, they're progressing, but maybe they just are not reaching that last point. Like we have to look at, like, there's something else deep down going on. Okay, what's going on with your cells? But, we were always encouraged, send them to Dr. Christian, because again, it's so, you hope that just conventional medicine is personalized in a way, of course, but I think what you're doing is definitely a little bit different and looking at the body as a whole. Even if someone's just coming in for like simple shoulder pain, or if it's a full body thing, I think, like you said, it's just so important to be looking at all of those pillars because, this is so cliche, but it's like your body is a temple and you need to be kind of throwing these things at it in a positive way to get the best results.
Absolutely. And one of the things that I do now, and I try to explain this to people, is, there's two type of car mechanics. You talk about, and I definitely enjoy it because you need both sides. It's not just the cellular stuff. If I fix the cellular stuff and you don't stress the body, you don't strengthen muscles, we're not going to have it. So we have to do all of it, right? What I explain to people is, in terms of what I do and how I approach things, is I tell them there's two type of car mechanics. There's one car mechanic that you go to when your light bulb is out, that is just going to replace the light bulb and send you on your way, okay? And there's another car mechanic who's going to ask the question, why is the light bulb out? Is it your wires? Is it your battery? More importantly, this is a car. Are your engines working well? Is your transmission working well? Is your brakes working well? Those are the things that actually, when they go wrong, are actually going to put you at risk instead of your light bulb. And the same thing happened in medicine. People show up with simple complaints. You have an elbow pain. Yeah, that's easy. I can fix it. But we are finding out people coming with these complaints, they're older, and we do this full assessment, and they have metabolic issue. Their insulin is very high. Their glucose is very high. Something else there that's actually going to create more problem for them and actually going to affect the ability to heal from this elbow pain that they came with, okay? So what I do is I tell people, yes, we can solve your elbow pain. We can solve your shoulder pain. But there's a lot more that's going on in your body that we need to pay attention to. Because if you're not getting enough nutrients in the system, if you're not controlling inflammation, whatever I'm going to do for you, your outcomes are not going to be as great. So it's helpful to really optimize the whole system and look at the main major systems that are involved in terms of how are we going to prevent disease? Because once you have disease on board, then everything else becomes a little bit more complicated.
You're making me think from a musculoskeletal perspective. I mean, there's so many clients that we'll see that are coming in for knee pain, and we're treating them. They get pretty much better. They start going back to exercise while they're still under our care. They come back in and they're like, oh, I actually, my shoulder's now bothering me. And then now we're adding the shoulder onto a different case. And then all of a sudden they're getting some neck pain because now they're working out. And I don't, part of me, now that we're talking, it doesn't feel to me that they just all of a sudden got these injuries because they're exercising.
No.
I think it's because there's something deep down, like you said, it's the wire, like what's happening with your wires in your body. Like, why can you not be able to exercise or do the movements, pick up your child without getting all these other things that are happening to you? And this is my light bulbs are going off right now.
Exactly. And I think sometimes it's very hard for patients to understand that because they go, I don't understand why. I don't know why this is happening. I went to pick up this piece of paper and my back is locked out. But there's always things that are happening that we may not be aware of.
Sure.
And even sometimes we don't want to be open to those ideas because we have habits. Sometimes people have habits that keeps them in that state, but they don't want to know that. Okay. Right. And it's also important for people to understand, especially when it comes to pain. Pain is so complex. And pain, as we know, is influenced by various degrees of your biology, your psychology, and your sociology. So when we're focusing on the biology alone, if people have psychology that is not optimized, or they have anxiety, they have personality types, I think you can kind of relate to some of these things as people who are controlling. And when we're dealing with pain, those individuals, they struggle to let go because the brain also is so much involved in pain that you also have to work on the brain. Okay. And if you've had trauma and other things, how your body is processing pain becomes something different. But it all comes down to how do we get you healthy? Because your psychology is part of your physiology. And I always say it's easier to hack your biology than to hack your psychology. People are not making good decisions because they don't have a good physiology. Their body's not healthy. When you're eating junk, you can't even make good decisions, right? But when we start treating people and we're getting them peptides and we get them to control inflammation, all of a sudden they're making better choices. What happened? Because now the body can make energy, things are working the way they're supposed to work. So it's really important to kind of look at all of those lenses to try to create something that translates for the person in front of you. Can
you talk a little about what a pain signal is? Is it a nerve response going to the tissue? Is it a chemical response? What is that?
Yes, that's a great question.
I think that's a big thing that even as physical therapists, I think is very important for us to be able, for any PTs listening, it's important for us to be able to describe, not go super in depth, but to the best of our ability, kind of show what pain is, because I think that helps people understand what's going on with their body a little bit. Like you said, it's complex, but I think it helps to hear a little insight.
Yeah. So a good way to understand pain in a simplistic version, okay, is that when you cut yourself, okay? So let's just take the incident of, you were playing soccer or whatever it happened and you twisted your ankle or your knee. Let's take the knee. You twisted your knee. All of a sudden your knee is inflamed and you have all this pain. So what is happening at the cellular level? When you twisted your knee because maybe you pull a stress on one of your ligament, all right? Let's say your ACL. So that ligament, when it's there and it has not been pulled, it's all intact, it's making energy, it's doing what it needs to do. Once you stress that ligament and it becomes injured or stretched, that cell, that ligament or whatever it is, or cartilage, let's say a cartilage, it starts shearing in that environment, and your immune system see that as something that is not supposed to be there. Okay, the immune system response is to heal. So your body sees that something is happening here, it's trying to go and heal it, and when it's trying to do that, it's gonna send signal to your nerves because it wants to make you aware of it. You have this nervous system that's sensing everything. So the first action of the cells is you have these immune cells. They're going to go there to try to heal it. We want to heal this. In the process of healing, they're creating inflammation. So inflammation is necessarily not bad. There's too much inflammation and under-inflammation. It's all about the balance when it comes to physiology. So this inflammation is creating to try to get things to heal. At the same time, that inflammation signal also goes to the nerve. You have nerves in this area. The nerves takes that information, and then there is all of this propagation of that signal to go all the way to your spinal cord. There's all these things that are happening to make you aware of that there's an injury here. So that signal goes to your spinal cord, it goes all the way to the brain. And then once it gets to the brain, then your brain will interpret that signal. Your brain is the one that's going to tell you it's in my left knee or right knee, and it burns, and it feels like this. So when people come in and we are asking about, tell me about your pain. How is it? Is it achy? Is it all of that? Is the brain kind of giving you that interpretation, okay? And that interpretation of that signal, of that inflammation that's going to the brain, that signal is interpreted in the context of who you are how you see the world and what else is going on in your life. Okay. So we have examples of people doing things where like they either playing a game or something. They even hurt themselves. They don't even know that they hurt themselves because their brain is not processing that. Okay. And we've had incidents of people doing something where they felt there's this story, and I think most people probably heard it. There's a guy who a nail went through his shoes, and he had this severe pain that he thought was like unbearable. He got to the ER, they opened up his shoe, and the nail was just in between his toes. Okay. But the brain, not that he faked it, the brain saw the context of it. So there's all of these things. So brain interpret pain signal. When people have chronic pain, the brain changes in terms of how it's processing that signal. So even when this is healed and there's a tiny simple signal that's coming to the brain, the brain makes that bigger. Okay. And when we're treating pain, what we do is we just give you medication to block that pain signal. We block it. The cell which is creating that inflammation or whatever cell that's in there, going back to the cell, that cells need energy to be able to make a good decision, not to create too much inflammation. But because it doesn't have good energy or good source of nutrient, then it's not functioning well. It's trying to do it, but it's not doing that well. And that creates that whole thing. So pain has a sensory and emotional component. The sensory component is when you can sense it. And then when the brain also, when the signal gets to your brain, there's an emotional component to pain. And the reason why we have an emotional attachment to pain is that pain is a protective mechanism. If you ever step on something hot, you know never to do it again, right? You remember it. Why is that? Because emotion helps to crystallize memory. When there's a lot of emotions, when you're a kid and something happened that you remember, it was like some joy, some emotional elevation that crystallized that memory. And pain is attached to the emotion so that we can actually remember, okay? So that's the problem. And because it's attached to emotions and your thoughts and your emotions are all connected to pain. And we've seen those in some of our patients. This pain is killing me, catastrophizing. The pain is killing me. I can't take this. When they do that, actually the pain goes up. When they're having good thoughts, they're like, they're out hanging out with their girlfriends and doing things and they're not thinking about the pain. Pain is not there. As soon as they get home and there's an argument or something else, pain comes back, okay? So emotion, thoughts are all connected to pain. So I guess it's a long way to kind of talk about the signal goes all the way up. And then your body have the capacity to actually modulate that signal going to the brain. Okay, your body makes its own endogenous opioids to control pain. It has neurotransmitters that determine how much of the pain comes to your awareness. In chronic pain state, that system is actually flipped around, where instead of decreasing the pain signal, it's actually upregulating that pain signal. And that's when people would develop this hyperalgesia or a state where a small touch creates a lot of pain in fibromyalgia.
I feel like I am relearning pain science.
There's all things that,
No, but I wish you were the one that told me about this in school because you were explaining it so well. And it's real, like, again, I feel like I'm relearning everything. It's all clicking for me really well right now. And I think it will be really helpful for not only patients, clients, anybody who wants to listen to this, but even physical therapists, other physicians. Like, this is really cool. And I'm thinking about it to myself. I have so many clients too, again, that they might go on vacation. They've had a wonderful week. They come back and they're like, it wasn't bad. I was walking on the beach. My knee pain or my hip pain was not bothersome. It was pretty good. It was relaxing. We had a great time. And then, maybe I have somebody who's doing really well. Then all of a sudden, maybe something happened at their job. Maybe they lost their job or they had a difficult coworker or things are a little rocky at home with their partner or their mother's suddenly in hospice. And all of a sudden the pain chart is through the roof and I'm doing a progress assessment and all of a sudden their outcome measures are looking a lot worse. Their pain levels are higher. But my question to you is how, from a PT perspective or even another physician's perspective, how do you go about telling that patient or that client, like maybe it is something that's going on at home without, like that's why you're pain. Because of course they're going to look at you like, why is my pain heightened? Like, why can't you fix that? And I think it's so much deeper than what we're able to offer in that moment. But at the same time, I think I could offer a piece of advice for them. It may be what your situation, but I think my long-winded question is, I think, there's a lot that's going on behind the scenes, but how do you typically go about that if you have somebody like that? How do you bring that up?
Yeah, so that's a great question because that's something that comes up all the time. I will have a patient that comes to me, chronic pain. They came up, like, my back pain is really bad. I can't move. This is horrible. I have pain going down my leg. I need an MRI. Okay, and then we just pause. Like, what is going on in your life? What happened? I just lost my daughter. Of course, your pain is going to go up. So it's really connecting those dots. So what I explain to people, I make it very simple. And it's going back to what I just said before. It's just, if anybody, physical therapist, and even a patient, for you to understand is that your pain, your thoughts, and your emotion are all connected in the brain. Okay? So when somebody died or you lost somebody at work or somebody, some stress event, that emotional thing creates stress. Cortisol. Cortisol creates inflammation. Cortisol makes your nerves more sensitized because it's a fight or flight response. So all of a sudden, any small thing that comes in becomes magnified, okay? So it's getting people to understand that, maybe the biology have not changed, but the environment of what is going on have changed, okay? So stress, that's just the simplest way to kind of translate these things. Mm-hmm. Any stress that you have will perpetuate your pain cycle, whether in the form of you lost somebody, whether in the form of somebody talking to you at work that you didn't like, especially people that have migraine. There's all of these things that triggers people's pain or increase that pain cascade. And it's a function of a stressful event. Mm-hmm. So getting people to understand that, yes, your pain is up. It doesn't mean that something is bad at the tissue level, because that's what people go to. They're not connecting the dots that the fact that I'm having a problem in my marriage is creating this stress that's keeping me in pain. And in fact, I've had patients who've actually gotten better because they got out of a bad relationship. Mm-hmm. That's not a way to kind of manage a relationship.
Get out of that relationship.
That's not how you manage pain. But
break up with them.
Exactly. So all of those are things that influence our physiology. Mm-hmm. And there is there's entropy. There's all of these forces that are, your body keeps score of all of those things. So when people go, I have no idea what happened, I don't understand it, it's something that has shifted in their physiology. And it could be a stressful response. It could be a thought response. Somebody says something to them they didn't like. I had a patient who used to get migraines, and it was somebody at her job who kept triggering these migraines. Every time that person is at work, this person interaction create this stress response, mm-hmm. and that manifests at the cellular level as threat, as cortisol, and then that will make everything worse. Mm-hmm. So it's really getting people to say, yes, we know that the pain is there. When you have stressful event, your pain is going to go up, okay? So this is where we dial in. How do we manage stress? Mm-hmm. It's not just treating the pain. Treating the pain becomes what you need right now is like, let's manage your stress. Okay. And sometimes it's hard. People are in situations and circumstances that are very difficult to navigate, but getting people to understand and having some way to kind of bring a state of parasympathetic dominance, because all of those things make your system hyper or sympathetic state, right? Everything's fight or flight, and it's not good for anything. It's not good for your gut. It's not good for your immune cells. It's not good for anything. When people are stressed, they get disease. They're not sleeping well. So all of these systems, things start going around. So I think it becomes education and getting people to recognize, like, yes, something has happened that's significant that we have to pay attention to. And then sometimes people also have to kind of sit back and connect that dots, because people will come to you and say, doctor, fix me, right? They want you to tell them why the pain has gone up. We did an MRI, there's nothing else there. And then it's that, so it's something, and it doesn't have to be anything crazy. It's just how physiology works. Your body is creating all this chemistry based on your thoughts, based on the experiences. So getting people to know that I can think differently about the pain. Even when you have that episode where pain has flared up and all of those things, how you talk about the pain matters, right? That's some of the neuroscience pain that came from the PT group. It's like, okay, I'm having this pain because I did a little bit of a walk, because I had a little bit of stress, and something else is going on. Not because I have a new herniation. And that's how people end up with surgeries and unnecessary treatment, because they go to the doctor and the doctors are not listening to what else is going on in their life and just go like, okay, we've done everything else. Let's do an MRI. The MRI comes back. Maybe they have a little herniation. Maybe this is why you have the pain. They fix that structural thing. They are still in pain. Okay. So surgery fixes structures. It doesn't solve pain. Pain is more complex. And we have to kind of look at all of those elements that's perpetuating that pain cycle to get people to bring that down.
I've had some clients that would, three that I can think off the top of my head, that used to write down any time during the week. It was during their evaluation. They would come in with a whole sheet or a whole book. And they had written down every day, every week of when they had experienced their familiar pain. And, they had done it, if I had started seeing them, they would come in each time and say, look at my, look at my sheet.
Yes.
And one of the first things I did was, okay, out of everything we're doing right now, one thing I'd encourage you to do is let's just put that on pause. I want you to see if you can go a full day without writing it down all the time. And even they would say, after doing that for a few weeks of not documenting it, they were like, it's funny, I don't remember when I had it. And it's like, okay, interesting that you don't remember it after a few days, right? And kind of getting them out of that hyper focus of looking at that sheet at all times. Another thing I was going to say is I'm a pelvic floor therapist, as you know, and I do see people that have pelvic pain. And a lot of times, again, there's no injury. It's not always because of childbirth. I treat plenty of women and men that obviously don't have kids, and they have pain cycles that is occurring through their pelvic girdle region. And that's another thing that we'll talk about, like what is going on? What is, are you sitting at work? Are you stressed at work? Tell me about the things that are happening throughout the day. Cause it is one of those things that is much bigger picture. Just for pelvic floor in general, we have to look at what's going on with your eating habits, your sleep, what's happening at work. If you're not working, what are you doing all day? Are you exercising? Because that is a big, big thing. But again, this applies to the whole body, not just the pelvic floor too. That's a huge, huge aspect.
Yeah. And then pelvic floor pain is one of those that's very complex. So thanks for the work you do. And, I did a little bit of it and I kind of shy away from it. But it all comes to, sometimes there's a lot of trauma underlying why people are having pelvic manifestations, okay?
Absolutely.
So your body keeps score and people have had trauma or incidents, whether, so it becomes when you're solving pelvic floor issues, it becomes like we have to peel this onion a little bit, okay?
Oh, yeah.
It's not just structural because a lot of times it's, people have had really bad traumatic events, whether it's through rape, whatever, it's some horrible things that they suppress. And sometimes people are not even aware of it because, again, your brain is trying to protect you. So people have had incidents in their lives where they don't even remember because the brain just shut it down. But subconsciously, that program is still there and the body knows it. Okay. And at some point, it kind of manifests. And what it is really getting people to understand resilience, your physiology. So when you're young, sometimes you can manage these things. As you start aging, as things start shifting, your body doesn't have that capacity anymore. Things are changing, and then all of this can become really manifested. So definitely when it comes to any pain, and especially pelvic floor pain, people need to do that neuroaffective component of it. They have to work because we don't see anything there, right? And it actually makes people feel a little off. We've done all this imaging. There's nothing to show that you have pain, yet you experience pain. And that's what we also want people to understand, that you can have pain without any structural damage. And in fact, that's why cellular medicine approach to pain make more sense, because then it actually fits that definition. Because when people have pain and they go to pain is done through the lens of 20th century orthopedics. Let's look at your x-ray. Let's look at your MRI. What is there? Okay. The x-rays and the MRIs don't tell us anything about pain. I want to repeat that for patients. X-rays and your MRIs don't tell us anything about your pain. It just shows us structure. Okay. If it was true that your x-ray and your MRIs tell us about your pain, why have you had a spine surgery and you're still having pain? And the structure is fixed. And they go to the surgeon and the surgeon tells them, look, we fix it. The herniation is fixed. Why are you in pain? Okay. We're just fixing structure. Pain is more complex. Pain is what's going on around there. And that signal going all the way to your spinal cord. You have specific cells in the spinal cord called microglia and astrocyte. They have intelligence to decrease pain or upregulate pain based on the signal. Okay? So even when this is fixed and there's a little bit of inflammation coming out and you're not a healthy state from a neurological standpoint, pain is still there. And then as you also know, as a physical therapist, there is always this biomechanical deficit that happens with pain. So I always stress when people have pain, nothing against other type of treatment where they're doing passive things, massage, other things, chiropractic care. There's a place for all of those things. But I always tell people you have to strengthen muscles. You have to do the physical therapy. Okay? Because what it is when you have pain, that signal that's going to your brain is a sensory nerve. It's a nerve that sends sensation. When it goes to the brain, there is a corresponding inhibition of your motor nerves. You have two, then the motor nerves comes in and inhibit those muscles. So when you have pain, there is always weakness, especially chronic pain. And what happens is people compensate, right? It was just down here. Now all of a sudden it's their knee. So you have to strengthen muscles beyond just the passive modalities when you have pain. And that is something that I think sometimes they get overlooked. And people will be saying, oh, you know what? I'm better. I don't need the PT. I'm good. They go. And then a few months later, they start having some hip issue or some other issue because the body started compensating, right? The whole place was not strengthened well. And then they try to go do something else. They end up injuring themselves. And then when you do that loop of an area that already have had pain for too long, your nervous system is already hyper around that area. You create more systems, and then it kind of makes the whole system a little bit hyper. So it's really, really important for people to understand that, this is more complex, and we have to work on all the other things that are influencing this cycle until it gets to the brain.
We often have people bring in their MRI findings, especially of the neck, the back, and a lot of times maybe their doctor hasn't called them yet to describe what's going on in the MRI. So they come in, they're a whole mess. They're like, oh my gosh, go through all the points. Like, look at this, look at this, look at this. And of course, if you are not trained in looking at something like that, and these are, big words, and it says there's bulging and, shifting in the spine, whatever it may be. And it can be really frightening words. Again, if you have not ever seen that before, but like you said, what you said, I resonated with a lot. I often will tell people, you may have somebody walking around right now that has a fairly large disc bulge, right? And they had an MRI and it shows a pretty big herniation or something like that, and they have no symptoms. And then you may have another Mr. Joe down the block that has, same build, pretty much, same height, same weight, same exact finding on the MRI, that can barely walk over. Maybe he's hunched over. Maybe he's, barely getting into his car. And it makes you wonder, why do they look so different, right? So like you said, it's not always the structure of what's happening. It's how your body is responding to what's going on around that. What's happening in the decor, what's happening at the cellular level, what's happening with all the other stresses, like you were talking about with the nutrition, the sleep, all those other components that add into this. So that's a huge takeaway, because again, I think this is a big educational moment for people that may be experiencing chronic pain too. Yeah,
and this is also something that's actually well studied and well validated. So there's people walking around who have bad, they just took normal people who have no pain. They did MRIs of their back, and they have like the worst imaging. And people who are walking around who have all this pain, and their MRI is fine. And I think that sometimes even confuse patients. They're telling me there's nothing on my MRI, there's nothing, those are the people that even they get more frustrated. Why can't my pain get better? Because the doctors are telling me there's nothing here. Am I making this up? You're not making it up. It's your response. How is your cells functioning? What else is going on in your life that perpetuates that pain cycle? So that's important.
Absolutely. Can you tell me a little bit about hormones? Because I think that's a big thing too. And you mentioned it a little bit earlier about like the perimenopause, menopause, even people that have low testosterone, dysregulation of their cortisol levels, like you were talking about, thyroid problems. How does that play into this?
So hormones plays a huge role in pain. And in fact, I did not know that till, a couple of years that I got into this, because when we talk about sex hormones specifically, so when we talk about hormones, it's not just sex hormones. So sex hormones are your testosterone, estrogen, progesterone, DHEA, some other type of hormones. But testosterone, women need testosterone, women make testosterone, and you make testosterone actually before you make estrogen. Okay, so you take testosterone and you change it. That's how you make estrogen. Okay, so women make, so testosterone is anti-inflammatory. It's also analgesic, and it's immune modulatory. It modulates immune cells, it controls pain. Okay? Progesterone is also anti-inflammatory, controls pain. Estrogen is a little tricky. Estradiol can be anti-inflammatory, or it can be pro-inflammatory. It can create pain, or it can decrease pain based on the levels of fluctuations. Okay? So there's people who have low estrogen and they have a lot of pain. And then there's people who have their estrogen goes up and now they have more pain. Okay? So all of those things are involved. And then estrogen also plays a part in immune modulation. Okay? So when people are getting a little older, and this is even how I got into hormone therapy, is like, because I'm trying to figure out all of the systems that plays a part in people's life. And women will come to me in their 50s or whatever, and they come to me, doc, I have pain, I have joint pain, my wrist, everything hurts, I'm not sleeping, my mood is not great. And what I see is people get put on antidepressants, people get put on sleep medications, people get put on pain medications. Now they're gaining weight. They're doing everything they can. All of these things are happening. They're getting put on all these different medications, and all they need is estrogen or progesterone to help them sleep. They're not sleeping. Okay? And sleep is so fundamental. We talked about how all of this is all connected. If somebody's not sleeping and when they go into menopause, it's a state of progesterone deficiency. You don't make it anymore because you're not ovulating. That's why you make progesterone. So hormones are so important in pain. It influences migraine. A lot of individuals that have migraines, it's hormonal regulated. So when people are going through their menses, and even a lot of women can validate, right? When you're having your period, there's times where you have a lot of pain. Why? There's an estrogen drop. Okay. And there's a way to kind of mitigate that. We can give you some supplement or something that helps to kind of balance those things out. And not only are those things important in pain, but they are also important in metabolic health. How does your body hold on to energy? Why are you gaining weight? Maybe you don't have any estrogen. They are also important for muscle health. And more importantly, and something that I've been seeing quite a bit and is very unfortunate. And I hope that if anybody is listening, females in your 40s and you're going through perimenopause, please, please, please ask your doctors to do a DEXA scan, okay? Osteoporosis, bone loss. This is such a preventable disease. In fact, one of the indications from the FDA for estrogen use is osteoporosis prevention. These women show up in my clinic. Oh, I went on a vacation. I hit something. All of a sudden, I have rib fractures. And I went in and I have osteoporosis. At that point, the only option they have is medications that potentially may help a little bit, but doesn't really solve the problem. And a lot of times it's all hormones, okay? So those are all things that we need to take a look at. Sleep is important, metabolic health, bone health, muscle. People even start having elevated A1C. Their glucose become dysregulated, yet they're eating well, they're exercising because they don't have the hormones. And then when it comes to hormone management, there is a lot of noise about hormones causing cancer. First of all, that's not true, okay? And in fact, the FDA has just come out with they used to have a black box warning on estrogen that says that this causes cancer. The FDA has removed it because there's tons of signs that say that's not true. Even testosterone in 2023, they used to say testosterone causes heart attack. That's also not true, okay? So hormones play such an important role in just overall health, and it's not just sexual health. So I use hormone to treat pain. And when I do that, then they don't have to be on an antidepressant. They don't have to be on a sleep medication. They don't have to be on all these things that actually create a lot of side effects. Yeah. So it's important to kind of educate people because it also changes mood. We talk about emotions. All of that influence how they're processing pain. They already don't have the anti-inflammatory support. Now their system and their resilience to kind of manage stress is also off. Of course, they're going to have more pain. And then they go, you're crazy, or there's nothing wrong with you. And your levels looks fine, okay? So yes, the levels can be fine and people can still have symptoms. So we have to also individualize and more importantly, listen to our patients.
Totally.
Yeah.
I think a big thing that I'm noticing right now is that there is just a lack of patient education in this whole story. Because there are even friends, family that are dealing with things that they didn't necessarily get their pain from an accident or an injury per se. It just kind of came upon.
Yeah.
And of course, whoever they talk to is like, it's just aging. And I hate that answer because I don't think that's true at all. And then it kind of makes you feel old all of a sudden. You're like, oh, it is just aging, I guess. But it's not the case. I think that, like you said, it's so complex, but at the same time, it can be simplified down to exactly what you're saying. And, people don't have to feel like they're crazy because everything that you're saying, I have tons of people in my life that are experiencing this.
Yeah. And then the hormone thing too. And I think it's also like, as you know, as a provider and a clinician, what we tell patients is so powerful. And it's very unfortunate that I'll see patients where doctors put these things in their head. I had a patient who had some type of QT prolongation, something they had, and they put them on a beta blocker. They were trying to figure out, I was asking them, like, what happened? And it looks like this person went through a very stressful event. She lost a kid, okay? Of course, that's a stress response that can change your physiology. And she has had echo, everything looks fine from a structural standpoint. And I'm not against the fact that she's on a beta blocker, but what they told her was this: if you don't take this medicine, you're gonna die. Mm-hmm. And there's no way that none of us can ever predict that.
If I heard that, I would be freaking out.
So there's also a lot of fear that has been put into patients. Right. My doctor said that, my surgeon said that, I should never take hormones. I'm doing so, and it kind of like, and what I do as a physician is like when people have, because it's a patient who suffer. If I'm telling them something different, it creates this incongruency, and then it's just simple education to say, well, that's not the case. Let me explain it to you, and maybe he's seen it from this way, and kind of make sure that people are educated, because that is a piece that I think we have to do better with as physicians and as clinicians. Okay. And I will say that that's not medicine as a society. I think that's an individual journey.
Absolutely.
People have to evolve. Medical school will teach you how to be a doctor, but it will not teach you how to become a great person. There's a lot of doctors who have nasty attitude and just sucks, okay?
Of course.
In terms of personality, they're great surgeons. Be a fucking human being. Yeah. I don't know if we can cuss on here, but
I totally agree. Though it's so true.
And that's not going to come from reading a book. You have to work on yourself.
Yeah.
None of us is perfect. You have to understand how your interactions affect other people. You have to go in a little bit deeper. and you have to grow. So there's different levels of intelligence. And, we have these people who are really good with like understanding technical things,
right.
but they don't know how to talk to people.
Right.
And that's not good for society. You have to evolve. Evolve. So people need to have this integral growth in terms of what we do as physicians, because it's powerful. And we've also studied this. There's placebo and nocebo, how even the doctor walks into the room, whether they have a fancy car key or whatever. They've studied all of these things at Harvard, and all of that translate. Little things translate. Okay. So I think we have to be very careful with the messaging that we give to patients.
Absolutely.
And it becomes educating yourself. If you don't know it, say, I don't know it. What happens is that if a doctor doesn't know about a topic, they just say, don't do it. Don't listen to that guy, what he's telling you, right? I'm helping a guy who has all these problems, and he needed testosterone. Since we got him on testosterone, his glucose is better, his lipids are better, everything is better. He's working out because we're combining everything together. And his cardiologist tells him it causes heart attack. Stop it. Okay? And then I send the paper. There's a paper, Traverse trial. There's a trial that has actually been. So I think, and I also understand, and nothing against like doctors who don't have this knowledge. There was a point that I didn't know any of these things. I was in the conventional medicine, and I didn't believe any of this stuff that, I went to Hopkins, I went to Harvard. Like, I know everything. Right. But I know how to solve pathology. And I think we have to have humility and listen to our patient, because even when we know all of it, even when you have the evidence, and that's what kind of like really shocked me when I started working. I came in, I was like very evidence driven, and I have an MPH, I have a public health degree. So I also know how to make sense of data. And I understand how you appraise science and how to translate that. But the person in front of you, you have to listen to them, because the evidence has to be based on a real person in front of you. And when we do studies, and I've also participated in clinical trials where you actually select the people who can show up to your clinic, who comes and participate in my study, the person who can get into a car and get here. So it's very selective. So we have to kind of have a little bit of humility with signs and everything else, and knowing that, it's more important to listen to people. And I guess the whole point I'm trying to make is like, we should not be putting very negative, scary things into patients' head. Okay. Hormones, I hear patients all the time. My doctor have told me never to do hormones. You have osteoporosis, you have osteopenia, you're not doing well, you can't gain muscle, you have all of these things. And everything we do in medicine is risk and benefit ratio. And because somebody doesn't have that knowledge, the simplest thing to do, and we do that in medicine, and that's just the programming we have, because it's first do no harm. So you don't want to harm somebody. So if you don't know it, don't do it, even if there's the benefit to optimize so many things. And it becomes education. So I think we have to do better. And I'm on the same journey. There's things that I know now. There's things that in 2 years' time I'm going to know. I'm still trying to tease that out. So
of course.
Important to have humility. Yes.
First of all, preach. I loved everything you just said. But I think part of that is, like you said, is own the humility. I think I'm going to consider myself a new therapist until the day I retire, because you should always be learning. Absolutely. You should never be the know-it-all. You should always be learning something every single year, whether it's about how you present yourself with the client, how well you are able to listen, pick up on things, ask more questions. And I think that's a lesson for just any clinician or person out there is, if you don't know something, like you said, tell the client, I don't know, but you know what? I'll look into it and I'll do my research. And next time that you come in, we'll do a full discussion on this. And hopefully I'm able to offer you the advice that you're looking for. But right now, rather than saying, just don't do that, it's not your place to say that from a professional standpoint, and also from a personal standpoint too.
Yeah. And then the problem that has created is that, like, now the experts, people don't trust us anymore. They go and follow an influencer. Then now they believe that somebody, and not that what those people are saying is not accurate, but you, the person who's a professional and a clinician and a person in front of you, you understand their individual story, right? Everything has to be personalized. So being able to help them make sense of things, because they're not feeling well. I'm not feeling well. Somebody talked about, and they would say, well, I listened to this podcaster who was talking about this, and I took this and I feel better, and I did this, it didn't work for me. So I think we, in this era of like so much, like with AI and everything else, right? Intelligence is actually going to become not a value commodity, right? They develop AI, and the first work it took away is from coding. The people who coded the AI, they lost their job. I mean, AI can code now.
I know, it's crazy.
And so what we're having is like all these intelligence things. We have to figure out, because now everybody can have access to the same information, and people are now educated and asking questions. So if you're a physician, if you're a PT, if you're anybody who is in this space, you have to also kind of try to meet people where they are. I don't know about that. Let me see if I can guide you. And there's tons of nonsense also out there online. So it's on us who have this a little bit of background to say, you know what, this makes sense, this doesn't make sense, okay? And how I look at things that people come up with me all kind of stuff, right? And I'll listen to them, what are they trying to solve? And I say, okay, what is this thing? What does it do? Is it safe? Is it effective? So the first place I want to check is it safe? If it's safe and I don't know much about it, try it. If it's not a cost prohibitive for you. And sometimes people are buying stuff that, there's also bad actors and people are buying all these things and they don't really translate. And then what I tell them is like, okay, when you get this thing, what's actually going to make a difference for you is your state of health. Okay. So if you buy this fancy, shiny thing that's supposed to help you with your neck pain or whatever it is, if you're not sleeping well, yeah, you get some neck pain relief, but it's not going to be that great. But if you were sleeping well and your hormones were balanced and you're eating well, and when you put that on, of course, your outcome is going to be different. So really kind of meeting people and providing guidance. And I think we have to do a better job of, simplifying things. There's certain things that are like a little dangerous. And it's like, oh, this, I'm not sure, And then it's also helped to then engage the person to say, you know what, ask your cardiologist. And that's the thing. So I'm in this space of cellular medicine and integration. Even though I understand the cell and I can face things that goes on in the cellular level, I'm not a specialist when it comes to pathology.
Absolutely.
I can optimize physiology. So always referring to say, okay, let's talk to the cardiologist. Let's talk to the endocrinologist. Let's bring all that team together to kind of make sure that what we're doing is safe. So that also needs to be done.
Tell me a little bit more about what happens when a patient walks into your door. What does that first day look like? What does it look like going forward? What are some of the therapies that you offer?
Yeah. So what I do now is I start with this thing that I call the health span assessment, which kind of comes back to the story of the car mechanic. Okay. So people come to me and they have a complaint, and sometimes they have multiple complaints. My gut is not doing well. I'm not sleeping well. I'm gaining weight. I don't have the energy. I have fatigue, all of these things. So it's multiple systems, but it all boils down to some place within their body where a cell is not signaling well, a cell is not making energy efficiently. So what we do is we do this comprehensive. First of all, I listen. I spend an hour with them where I listen to all of their complaints, what's going on, ask more questions to try to kind of help them be directed. And then we establish that and I ask them about their goals. And then from there, we do this comprehensive lab, head to toe. We're looking at nutrition, inflammation, hormones, and cardiometabolic. And then looking at markers that actually predict disease. So a lot of the labs that we do actually are looking at trying to diagnose a disease. For example, if somebody is trying to, if we're trying to figure out if you have diabetes, we're just going to order A1C and they will order just glucose, okay? Before the A1C become abnormal, your insulin for many years is already dysregulated. There's other factors, there's leptin, there's all of these other markers. So what I do is I look at markers that predict disease. 10 years, diabetes just doesn't show up. Obesity doesn't show up. Heart attack doesn't show up. They are all been building over years, okay? So what it is we have to take a different lens. So my lens is like, let's figure out, yeah, your glucose is fine, but your insulin something is wrong with your insulin. Something is wrong with your thyroid. All of those things are actually going to put you at disease risk. So we do all of that, thyroid hormone, cortisol, nutrition, all of that. And then I spend an hour and a half to review all of those things with them because we're trying to make this precision. It has to be about your biology. People take supplements that they don't need. I believe in supplement. Based on your lab, do you really need that? If you don't need it, why spend money on it? And then more importantly, because somebody talked about it, and people need to understand that even when something is natural does not mean it's safe. What is safe for you may not be safe for me. What is safe for you today will not be safe for you tomorrow. And people go, I've been taking this all of a sudden I develop an allergic reaction. Okay, yes. So things are always changing. So we talk about, based on those labs, we talked about lifestyle. That's the foundational thing. Okay. None of the things I'm going to do is going to work well if you still eating junk and you not really optimizing health. So we talk about those things and then listen to people's stories and try to give them strategies. Because sometimes people don't even know. They're like, I have all these people, they're trying to lose weight. And they go, yeah, I eat snacks. I eat multiple times throughout the day. I was like, I eat snack before I go to bed. That's like the worst thing you can do if you're trying to lose weight, okay? So if you're out there and you're eating snack before you go to bed and you're trying to lose weight, don't do it. It's the worst thing you can do, okay? I know.
Darn it.
Okay. So, and it's all balance. Okay. Yeah. So really kind of educating and connecting the dots. They go, I don't know why I don't have an energy. You're not sleeping.
Right.
You're going to have fatigue. It's not like, it's not like I need to go give you a mitochondria peptide. Let's get you to sleep. Okay. Your body is going to make those peptides if you get better sleep. Okay. So we look at that. We talk about lifestyle, nutrition, exercise, stress response, community. And it's also important to stress this in the case of longevity medicine. Community is so important. having community, having relationship, all of that is good for your health. Okay, so we talk about that, and we talk about supplements specifically. What do you need based on your labs? Okay, maybe we don't want to jump to a statin right away, but you have all this other risks that suggest that we got to do something. We can put you on a supplement. We talk about lifestyle, and it's also very important for people to understand when they go to their doctor and we are ordering lipids. Okay, this is how we used to put people on cholesterol medications. We just order your cholesterol, total cholesterol, LDL, HDL, triglycerides, and then based on that, you put people on cholesterol medication. That's the wrong way to look at it. That does not quantify your risk, okay? And in fact, low cholesterol, there's a bell curve where, because you need cholesterol, we're talking about hormones. How do you make hormones? You take cholesterol, you put it through your mitochondria. In fact, you take it through your mitochondria to make something called progesterone before you make testosterone and before you make estradiol, okay? So going back to cellular medicine, even if I improve your mitochondria, your hormones can improve. Okay, so I don't have to just give you hormones. I can improve mitochondria function, and your body will efficiently make it. The body has all this intelligence. Okay, but the whole point I'm making is
like my brain is exploding right now.
Exactly. So the point is that we don't need to suppress cholesterol. You need cholesterol for the membrane of the brain, everything in your. So it's a cofactor. You need it for so many things. So what we do is we check that, and then we check the lipoproteins, the compositions of the LDL, because the LDL itself doesn't give us any information of how dangerous it is. Is it oxidized? Does it have an oxygen attached to it? If it is, then that's more dangerous. If you have small density LDL and it's higher, that's a problem. If you have Lp(a), there's another type of protein that is actually more genetic. I have one of those. Some people have it, some people don't. Do you have inflammation in the vessel? Do you have something called PLSC, MPO? So there's all these markers that we have to do to quantify whether you need statins or not. But we don't do that. People just get total this and they just give them that. So anyway, the test we do, trying to get back to the question you asked me, how do I work with people? We go through all of that, focus on those things that are going to actually kill you first. If your engine is not working well, if your cardiovascular system is messed up, your energy system is messed up, we need to fix that first before we talk about your weight loss, okay? So we put all of those lifestyle things in place. We talk about supplements. We talked about small molecules. There's place for pharmaceutical drugs. There's a lot of drugs that actually works really well. And it's just, and then even now that I've kind of learned a little bit more, it's just that doctors don't take time to learn how to use these drugs or what is happening at the cellular level. And then how do you make this drug more efficient? Or how do you mitigate side effect? We talked about peptides. GLP-1s are one of my favorite peptides. People get freaked out about it. It's bad. People are not educated about it, okay? That's a great peptide because it's something that actually helps improve the energy system of the body. And we talked about everything going back to energy. If you can make energy efficiently, the body will take care of itself, okay? So GLP-1s, we talk about that. We may talk about hormones. And then I have specific programs based on what people's goals are. And based on that, we can either put you on a hormone program, a metabolic program if they're trying to lose weight, they're trying to improve, prevent diabetes and all of these things, a longevity program, a performance program. And there's all this specific other testing that we do. We get a little bit deeper to try to figure it out. So if you're in a performance program, what else are we going to do? We're going to do a VO2 max testing to understand your VO2 max, your metabolic profile, oxidative stress markers to look at how much stress are you putting on your cells. There's a lot of performance, high performance. They do too much. Okay. The benefit of exercise comes when you are recovery. It's not when you're doing the exercise. So the recovery piece needs to be optimized. And sometimes I see people, especially as they get older, they're doing way too much.
Sure.
Just do 3 days a week
Agreed.
And rest. And they go back and go, oh my gosh, I feel so much better.
Yeah.
Okay. So that's where we start. And then, respect people's goals and kind of support them and kind of go from there.
Talk to me about this therapeutic plasma exchange program, because it's something that's not super prevalent in this area, correct?
Yes.
What is this?
Yeah, so therapeutic plasma exchange is basically a way for us to take out your plasma and replace it with albumin, okay? So this is a procedure that has been done for more than 50 years in the hospitals, and it's classically used for people that have autoimmune issues. So if people have MS, people have myasthenia gravis, where they have so much antibodies that's affecting their cells, we can put you through this machine and it basically pull blood out of your arm and clean it out, take out all those bad things, take it out, and that's how we heal you. So a lot of things we do in medicine, we are always putting in. We're giving you more supplements. We're giving you more medications, more injections. This is a way for us to take things out, okay? Right. So when the fish is sick, you change the water. You don't put more stuff in the tank, okay? So that's basically a simple analogy for people to understand. So what we're using it for is that there's a lot of people who have autoimmune issues where they have either rheumatoid arthritis or they've had COVID, or a vaccine-related injury where their whole immune system is now dysregulated. They have all these immune things that are floating in the environment, okay? And then they may also have a lot of toxins. We are exposed to tons of toxins everywhere in the bottle and everything else that we're doing. And all of those things are things that your body can manage. But in the context of stress, it's all about physiologic resilience. So somebody can manage that when they're healthy. But when somebody have other assault, whether from an infection or a disease state that make the immune system more tasked, then they are more likely to develop a disease. So what we do is that this therapy helps to kind of take out all the junk in the plasma. So the simplest way to think about it is like an oil change for your body. Because when we do that, we remove all the autoantibodies, the toxins, everything comes out. And it's just a good way to reset the immune system. So there's tons of literature and studies on this for even longevity, where people's biological age has been decreased by 2.5 years. But I don't get really stuck to those biological things, because it's all about how do you feel and other things. So there's still an evolving science when it comes to longevity. We can do it for that reason. But people that have a lot of mycotoxins, environmental toxins, and we do it and we see, we retest it, and the levels are going down and they're feeling better. So that's a therapy that we are super excited to have in the main line.
And it's one of like the first in the outpatient.
First in the outpatient in this area. So nobody really have it here. I wanted to kind of invest in that, because my whole point was trying to figure out, again, it's all about the cellular medicine. How do I make the cells make good decisions? We're talking about the intelligence of the cell. If that environment that the cell lives in is full of toxins, it doesn't make good decisions, okay? Because the toxin actually affect the mitochondria. The toxin makes the car not work as well. It kind of basically pollutes. It's like putting water with your gasoline into the car. Okay, it's going to be choppy. It's just like, it's not doing it. It's not performing as well, and it may break down the car. And that's exactly what toxins do. They go in there, messes up the mitochondria. When the mitochondria is broken down, and the mitochondria has a DNA, and it's very fragile, because your nucleus has a little surrounding around it. It has a little coating. Your mitochondria, on the other hand, is very naked. So when there's these fumes and this heat, they start damaging your mitochondria. This is your energy system. And then that leads to disease, and that leads to fatigue, and that leads to brain fog and all of these things. So TPE gives us a place to be able to reset that internal environment so people can heal. You are like the ultimate car mechanic. I'm going to share your number with everybody I know. Now, tell me a little bit, like, out of all the different therapies that you use, because I know you do like PRP and stuff like that, what do you think is the most common thing that you utilize with patients? Yeah, when it comes to musculoskeletal pain, one of the things that I love to use is something called prolozone. Okay. So prolozone is basically using all this mitochondria nutrient. Instead of injecting steroid into your joint, there's a place for steroid, but when people are older, steroid can be chondrotoxic. It can affect the chondrocyte, the cells. Okay, it helps with inflammation, but then it also affects other things and tendons. So what we do is we use this mitochondria nutrient and we add ozone, and ozone is actually a medical grade oxygen that we add. It's basically O3, and when ozone get into a joint, it increases the blood flow and nutrient and oxygen like 3 times. It helps the blood to carry more oxygen to the joint. Wow. And the problem with joints and tendons is that they are hypocellular and avascular, meaning they don't have a lot of blood supply, and they also don't have, they can't do things. So when you injure a tendon, it takes forever. But when you injure a muscle, it heals. There's tons of blood flow and everything gets better. So this is a way to kind of give the cell what it needs to be able to heal itself. We do PRP. I don't do PRP as much because PRP is dependent on you, your physiology. So when you're not healthy and I take up your junk and re-put that back into you, your outcomes are a little different. Okay. Sure. And there's peptides and there's all of these other signaling molecules that we can use to get people to get better. Amazing. That's so cool. And again, I think it's so important for people to just know that there are all these other options, because I think it's not something that's brought up in conventional medicine most of the time. And again, I think this is important for other PTs, other, OTs, speech pathologists, whomever is watching this podcast, to know that these options are hopefully out there, whether they're in this area, seeing you, or, in any other area across the country, hopefully. I mean, is it something that's getting more prevalent, this type of medicine? So yeah, cellular medicine is, becoming more prevalent. Longevity medicine is becoming more prevalent. And the whole idea of longevity medicine, I think it also kind of has a bad rep. Anti-aging, people can get a little extreme with some of these characters online. The whole idea is to prevent disease. Okay. Yeah. And then it's also like, it's a personal thing. It's nobody needs to live to 100 and whatever, it's just living longer healthy. because what we've seen is that even though as a group of people, our life expectancy has improved, our average life expectancy is in the 40s. We're like 45 years old. That's the average. Okay. Now we are in the 70s. But people are living in the last two decades or last decade of their life in not good health. They don't remember, they can't function, they're a burden on society, and that's what longevity medicine seeks to prevent. How do we get you healthy? And there's a science to it. This is, people just sometimes would think, oh, this is like, it's not well. But no, we understand biology. We understand why we age. There's fundamental cellular dysregulations that are happening as to why we age.
Right.
In a simplistic terms, you age because your cells age.
Okay.
And we can do something about how we reverse that and how to slow it down.
Sure. I'm going to ask you a couple of rapid fire questions before we finish up today. Okay. Give me what is the most overrated supplement and most overrated pain treatment in your opinion? Just in the realm of medicine.
Things. Oh my gosh. Overrated supplement. Let's see.
What do you think like everybody's taking that you're like, I don't know if you need that? It's more expensive pain, as the people say.
Okay.
Because I personally take athletic greens, if you've ever heard of that. Yes. And I take it religiously because I'm like, oh, it must be good. But then at the same time, I'm like, do I need it?
Okay. Okay. So
I just like things like that.
One that is overrated, probiotics. Okay.
Interesting.
Probiotics are nonsense. Okay. Not nonsense. There's a place for it. People kind of respond to it. But basically, the best things that you can do is prebiotic, okay, or postbiotic. Because the prebiotic is what's going to feed the microbiome, but probiotic is a hit or miss. So probiotic is one that I would say, overrated.
Okay. What about overrated like pain treatment? Because
steroid injections.
Oh, I was going to say the same thing.
Steroid injections without any addressing anything else. Okay.
Boom.
Boom. Boom. Boom. It's insurance. 3. Oh, we got to do 3 before we do this.
Yes.
People are not getting better.
Okay. Why ether medicine? Why'd you call it that?
So ether medicine. So ether is historically is a term that is like the 5th element. So when they were trying to discover all the elements in the world, like sun, fire, whatever. So ether was that. And then in quantum physics, ether is this energy that overwhelms all of the galaxies. So when we look at all the things that makes up of the universe, okay? So, I like chemistry. So we, the higher elements, nitrogen, carbon, and oxygen, we are like 0.3% of the whole universe. And this is a whole bunch of things, okay? And then when we look at the stars, they're made up of helium and hydrogen. Mm-hmm. They are about 3%. All these massive stars, okay? The sun is the smallest star in the universe, okay? All these stars, trillion, whatever, billions of them, a small percentage of it. And then there is this thing called dark matter, which is 23% of the universe, which is like all the space between all these galaxies and all these places, okay? And then there is this force that they actually discovered in 2018 by scientists from Hopkins and Australia that the universe is expanding. And what is making it expand is this energy that overwhelms all the galaxies, and that's the ether.
Amazing.
So we wanted to ascribe, it's kind of esoteric, but the idea is like, I found the word, and I was like, oh my gosh, we want to ascribe to something bigger. So if you believe in God, whatever you believe is the energy of creation, is the energy of God, and it connects everything. So, in a way, it comes back to what we do at ether medicine. Everything is connected. Mm-hmm. The cell, everything is connected, and everything has intelligence. So if you can kind of respect that intelligence, people do well. Okay.
This is excellent.
Yeah.
My last question, where can people find you?
Yeah,
so there's going to be a lot of people looking up your name.
Please come see me. I would love to, because there are solutions. And I think I see things that it just it breaks my heart, because I've seen people, it's just simple things. And we're not solving just the pain. They get better. They're having better sex. They were like, oh my gosh, I couldn't believe I thought this was done. I thought I'm just old. They're now building muscle. They're doing all of that stuff. So all of that to say, if people are interested in seeing us, my practice is called Ether Medicine, and we are in Wayne. So Ether is AETHER Medicine, MEDICINE.com. So you can go to ethermedicine.com to learn more about us, or you can also give us a call, 484-806-1101.
Well, thank you so much. I really appreciate this. Seriously, this was such a fun podcast.
Awesome.
And we'll keep learning, keep moving, of course, and we'll see you next time.
Thank you so much.